Hello, and welcome to NCG's Physician Billing KPIs webinar. As your practice advocates, we are helping to redefine the way healthcare is delivered. Since 1979, our mission has been to provide software, strategy, consulting, and technologies that help create next-generation RCM solutions. We make it possible for healthcare agencies around the country to reap the benefits of our entire suite of tools designed to maximize practice management benefits and overall cash flow. NCG Medical, in a little over 3 decades, has affected over 2,000 healthcare facilities nationwide with services ranging from practice mergers and acquisitions, strategic planning, financial advisory and compliance, to operational improvements, transactions facilitation, clinical and technology integration. But the important message here is not longevity, it is dependability. Improving the way healthcare is delivered is not just a tagline, it's what we do one client at a time. Before we get started today, I'd like to introduce myself. My name is Heather Miller, and I have been working in the healthcare industry for over 20 years. I've assisted hundreds of practices with diagnosing and solving problems. I've dealt with issues in revenue cycle management, Medicare and Medicaid compliance, practice flow workflow analysis, the implementation of electronic health records, and strategic business planning. I'm excited today to share with you NCG's Physician Billing KPI webinar. So have you ever asked yourself, how does your medical billing department stack up to the industry best practices? This is a question that is unfortunately not asked very often among administrators and physicians. Furthermore, it is extremely uncommon to find medical practices that operate under strict benchmarks and metrics and have analytical tools in place to monitor daily or monthly activity. Today's webinar will highlight the use of KPIs in understanding and monitoring your medical practice's current financial status. With the current status of the healthcare industry, this is something every practice manager out there should be doing. Today's agenda is going to highlight and discuss the top KPIs each medical practice should be monitoring. First, we're going to define a key performance indicator. Then we will discuss how to choose the correct KPIs for your practice. I will then outline the top physician billing KPIs that your practice should be reviewing and what records you will need to run and what questions you will need to be asking. We will then highlight how this KPI data can be used and how it can be communicated to your physicians without giving them a long, detailed report. So let's begin with what is a KPI. A KPI is a key performance indicator that is defined as a measurable value that demonstrates the effectiveness of a business process at contributing to the attainment of key business objectives. So in lay terms, it is a measurement that you will be monitoring on a consistent schedule to be able to monitor and or determine if the goals you have set are on target or not. KPIs are used in all types of businesses to assist with the monitoring of company benchmarks, etc., and all industries have different areas that they need to monitor. For the purpose of this webinar, we are going to focus on an ambulatory physician office, highlighting some of the top KPIs currently used within the medical field. Before we get started, let's discuss how you can choose the right KPIs for you. Choosing the right KPIs relies upon a good understanding of what is important to your medical practice. What is important often depends on the specific specialty or department you are measuring the performance of. For example, the KPIs useful to the doctor will be quite different from the KPIs assigned to the billing department. Since there is a need to understand well what is important, there are various techniques to assess the present state of business and its key activities and their association with the selected performance indicators. These assessments often lead to the identification of potential improvements. So performance indicators are routinely associated with performance improvement initiatives. So before you choose the KPIs for your practice, you will need to understand what is important to your practice. First, you're going to need to complete an assessment of the present state of the practice. Second, you will need to identify the key practice activities and measure them. And then lastly, you will be able to select the key performance indicator based on these results. To assist with this process, let's go ahead and discuss some of the top KPIs currently used within the healthcare industry. In today's challenging reimbursement era, there seems to be no end in sight to the complexities of medical billing. Despite the obstacles, you have to be on top of your game to ensure that collections are optimized. There are always plenty of work to do, but how do you know if your operation and the staff you employ to carry out your game plan is performing at full speed? Developing a process of key performance indicators can maintain your focus on success. So consider these core key performance indicators to establish the framework for your practice. Number 1 being the days in accounts receivable. 2 is a breakdown of the accounts receivable by payer. And 3rd is a KPI of your net collection ratio. Based on the results of these first 3 core KPIs, you should be able to get an idea of where the practice's current financial health is. It will allow you to compare your results to the benchmarks and determine if you will need to dig a bit deeper and determine where potential issues or concerns are coming from. This will then involve breakdown KPIs that drill down into the data and assist with identifying where the issues and trends are coming from. The first KPI we will discuss today is total days in accounts receivable, or AR. This is going to be the KPI that tells us very quickly, on average, the amount of time it is taking for a service to be paid in full. To calculate days in AR, you will need to run 2 reports from your practice management software. The first report is a financial AR summary report for a specific time frame. This could be 6 or 12 months typically. This report is going to provide you a summary of the total charges and payments for that specific period. The second report will be your aged accounts receivable, and this will summarize patient and insurance aged receivables owed to the practice year to date. There is not a date range needed for this report. It will provide a current AR balance for the practice. To calculate the total number of days in AR, you will need to find the average daily gross charge by dividing the total amount of charges by the total number of days that the report is reflecting. So if you ran it for a calendar year, you would divide the total charges by 365 days to get a daily gross charge amount. Now you will need to use the second report to get the total AR and then divide this average by the daily gross charge. This will then give you the average number of days your accounts are in AR. So is that good? Well, Medicare usually pays about 14 days after receiving a claim. Some HMOs pay claims at 45 days after receipt, the time allowed by law in some states. As a best practice, where most of the revenue is generated from office visits, the metric should be less than 30 days. Surgical groups or other types of practices with a large concentration of hospital-based services, the metric should be between 30 to 40 days. If your metric is above 40 days or in severe cases above 50 days, you have an indication of major collection issues. So let's look at an example. If you have charged $280,000 in the past 6 months, and if there were 182 days in those months, your average daily revenue is $1,538. If your total accounts receivable is $70,000, the days in accounts receivable is 45.5. It is taking basically an average of 45.5 days to collect your payments, thus presenting a result that this practice's billing department is an average performer, as we discussed in the industry standard benchmarks. Now, you might think that 45 days is beyond average for your practice and change your benchmark and/or target for your billing department to 35 days. This would then reflect a different outcome of the performance results. Again, reiterating that KPIs are based on your practice needs and performance targets set by the management team. The second top KPI is aged accounts receivable over 90 days. This can be a summary or divided up by each of your payers. This will be used to monitor your AR and whether it's coming from and allow you to see the collection trends of each of your payers. It will provide you percentages of where these receivables are. The longer an account remains unpaid, the more likely it will return into bad debt that the practice will have to write off. You will want to know, are there any payers behind, and why are they behind? Has a new payer-specific problem arisen? Or are you dropping primary and secondary claims quickly enough? Calculating the individual 30, 60, 90, 120, 120 plus days outstanding bucket is an important piece to be watching. As an AR ages past 90 plus days, it becomes harder to collect and more resource intensive. AR aging past 120 days outstanding has a very high percentage of becoming uncollectible and being written off to bad debt or sent to a third-party collections. Being that accounts sitting in the 90-day bucket are at risk of becoming uncollectible next, it makes sense to manage your AR against a 90-plus day metric rather than the 120 days due as traditionally done. This means that all outstanding AR greater than 90-plus days should be no more than 50% of your total receivables. The recommended practice is less than 12%, where the higher performing billing officers operate at less than 10%. The third KPI we'll review is net collection ratio. This is what your practice should have collected after the insurance adjustments have been applied. The net collection ratio is calculated this way: cash collections divided by net charges. Net charges are the gross charges minus required government and third-party contractual adjustments. From gross charges, you will subtract only your mandated third-party adjustments. Include in these adjustments only those write-offs that you have taken because of your contracts with either the government or third parties. This would include Medicare and Medicaid write-offs and commercial write-offs, which you are required to take because you accepted the plan's fee schedules or rules. It would not include write-offs for bad debt, charity care, eligibility or registration errors, coding errors, or late filing. It is important that only these mandated adjustments are included in this calculation. Be sure to use gross charges, insurance adjustments, and cash collections from the same time period when making this calculation. Typically, a monthly activity report from your practice management will be able to provide you the information you need to calculate this percentage. This report will provide you a summary with totals for charges, adjustments, and payments. So what do you want to know? You want to determine if you are on track for the year, and if not, how do you explain this variance? Are you collecting everything you should? And if not, why aren't you? Collection ratios should be between 90 and 100% after write-offs are taken. If net collection rates are lower than this, then an audit of billing productivity may be necessary. Again, the first step in obtaining an accurate evaluation is to set your charges at a percentage of Medicare. You should also know what your payer mix is and how each managed care company is paying you as a percentage of Medicare. This may be more work than what you want, but it's worth it if you want a thorough evaluation. The net collection ratio does vary by specialty. Practices that have a high net collections tend to be stable practices with a low percentage of new patients and tend to be the medical specialties where patients assume they will come back to see the physician year after year. Practices with a lower net collection ratio might include practices with a high transient population, some surgical specialties where the patient feels they will never have to see the surgeon again, and practices with a high percentage of new patient visits. It is critical for the practice to monitor this ratio monthly and track it over time. Both the MGMA and practice support resources do have normative data by specialty that can be used to compare yourself to your peers. Using a monthly summary sheet of these core top KPIs can assist with communicating these results to your physicians and organize all of this information in one simple location. The example above is a quick and easy format that will highlight the core key indicators we have discussed and identify any potential areas that might need a bit more research to determine what the things are causing the practice to not meet their established goals and/or benchmarks. You must use your KPI data. Following within industry norms on key measures should certainly be your goal, but it's easy to be distracted by the multiple of external challenges that influence your performance. So for this reason, you need to recognize the upper limits. That is the OMG, or oh my gosh factors. For days in AR, get nervous when it rises over 65 days. For receivables over 20 days, set the panic alarm to go off at 20%. For net collections, investigate staff performance and office policies when it hits 90% or lower. While underperforming at times on some or several of these indicators may be a fact of life in your situation, it pays to have a line in the sand that will signal you to dig deeper for opportunities to improve performance. So in most cases, you are going to have to identify additional KPIs that will assist with you looking further into the practice data to help determine where the issues are coming from. Based on the results of the first three core KPIs, you should be able to get an idea of where your practice's current financial health is. This will allow you to compare your results to the benchmarks and determine if you will need to dig a bit deeper and determine where potential issues and concerns are coming from. This will then involve breakdown KPIs that drill down into the data and assist with identifying where the issues and trends are coming from. The KPIs we will discuss today are a percentage of non-contractual write-offs, new patient ratios, and/or your practice referral mix and breakdown of your payer mix. Of course, there are many, many more, but for today's webinar, we're going to stick with these four. Our first drill down KPI is percentage of bad debt. You will need to run a current write-off analysis report monthly for your practice management software. You will then be able to monitor monthly and identify any trends or changes in the write-off patterns. You will want to know if there are any monies that are being written off that should have not been. Is there a write-off process clean, and do you need an approval process for specific write-offs to happen? Write-offs are often a result of the practice's inability to collect money from patients or meet payers' claims, filing deadlines, or are the result of an internal administrative mistake. Each different type of write-off should be identified. For example, contractual, bad debt, professional courtesy discounts, etc. It is recommended that all services be posted at the practice's regular fee schedule amounts. Professional courtesy discounts and other discounts are credited using special codes created by your practice. Each code is specific for each type of write-off. This allows your practice to track the categories in which most of the write-offs have occurred. The physician in the practice should remain involved in monitoring the write-off activity for the group on an ongoing basis to ensure that inappropriate insurance denials are not routinely being written off in error, and identify poor administrative processes that will need to be analyzed and fixed. To calculate the percentage of true bad debt, you will need to divide the total of write-offs due to preventable billing issues by the full total. Industry average of 5% bad debt or less is what you should be looking for, with better performers showing as low as 2% bad debt. Another drill-down report is your new patient ratio. A utilization report that summarizes new patient versus established patient will help let you know if you are maintaining a good balance of services and are there services that are under or overutilized. What do you want to know? Are we maintaining a good balance of services? Are there services that are being underutilized or overutilized? Primary care practices should strive to have at least 25% new patients, unless a very mature practice where specialty practices should have at least 50% new patients. Another good drill-down report is a referral report that will break down your referring source by the patient name, service diagnosis, charge, and revenue. This will help you to know who's referring to your practice and what type of patients are being referred to you. Benchmarks are practice-specific and should be set based on practice targets and marketing efforts. They are being made to increase your current referrals. Targets can be based on these efforts and outcomes desired. Another good drill-down report is payer mix. This report will let you know if you are maintaining a good balance of payers and determine if you need to limit any payers or look at a possible renegotiation of payer contracts and fee schedules. You will run a payer mix report from your practice management software. This report will measure payer mix by charges, revenue, encounters, or active patients. The most valuable factor being revenue, if you can adjust your report to reflect this. Industry standards suggest that you should have no more than 30% of any one payer unless purposely working with an underserved population. Having a diversified pay base will prohibit you from losing a large percentage of revenue should an issue occur with that specific payer. The use of a dashboard system to help demonstrate the results of a KPI is also very helpful. Here's a great example of a type of dashboard demonstrating the payer mix KPI that we just discussed. It provides a clear and easy to interpret representation of how your payer mix is broken down. You can then also monitor this over time and even better compare to previous years to see how things are changing and how these changes can be affecting your bottom line. Once you identify issues, you can then proceed with the digging deeper into the specific payers and determine what things have changed and are affecting these payer mix changes. We will be following up this webinar with another series highlighting the use of dashboards and monitoring your KPIs. Incorporating these best practices and metrics into the monthly evaluation of your practice or billing department services, along with other methods, should give you a good feel for the performance and overall health of your business. Today's healthcare revenue cycle remains as complex as ever, but with the use of dashboards, a practice administrator can also quickly and easily provide this very detailed data to your physicians in a meaningful way. Live dashboarding with summary reports are the way of today. Providing them the detailed, lengthy financial reports will confuse them and provide them more information than they really are looking for, kind of open up a can of worms you could prefer to avoid. To conclude, it is important that if your practice is not tracking KPIs on a consistent schedule and setting benchmarks to ensure your practice success, this is a must-do to be able to successfully perform in today's healthcare industry. Join us for our next webinar series where we will highlight the use of dashboards and presenting this information and how to address potential trends, for example, loss of revenue within medical practices. Thank you again for attending NCG's presentation of physician billing KPIs. If you have any other questions or need additional assistance, please feel free to contact NCG Medical at 1-800-330-1906 or email us at solutions@ncgmedical.com. You can also find us on our website at www.ncgmedical.com, or you can follow us on Twitter, join us on LinkedIn, or even become our friend on Facebook. This is where you can get up-to-date industry news and any new technological solutions that are out there. Thank you for attending our webinar.